Okay. Good afternoon, everyone. So I've recently joined Max's team at UCL. I'm currently working on betel nut-associated oral cancer. In this presentation, I'm just going to quickly give overview of our current efforts towards awareness and prevention. So the betel nut or Erica nut is typically looks like what is in this slide. So it's a fruit that is mainly grown in the tropical areas, India, Pakistan, Bangladesh, or Myanmar, Taiwanese areas. There is cultural practices from about 2,000 years to traditionally or ritual cultures to consume this fruit. And there is, according to WHO, it's about 600 million people globally take this fruit. So that's why it's making a most common psychoactive substance. Although there is a misconception that this fruit gives some health benefits, it helps in digestion, yet it's not scientifically proven, and therefore rather it has some negative implications on health, specifically oral cancer. So if we look at the oral cancer spread globally, we can see majority is in Taiwan or Papua New Guinea, and followed by India, Pakistan, Bangladesh, Myanmar, so South Pacific area. Currently about 350,000 oral cases, and they have 50% mortality rate in 5 years. If we look at the country-wise distribution in this pie chart, we can clearly see about 33.8% major contribution by India of this cancer, and therefore we have decided to fight in that zone in our first stage. Currently, we have initiatives like BICRA web app. So on the BICRA.org, we've collected so many of the surveys. So it's just a set of questionnaires based on if the person has chewed betel nut, on their socio-economic background. So those kind of questionnaires, and then we help them to understand or explain that if they are exposed to this betel nut cancer or not. And then the bottom of this is typically our web page of the betel nut at AGENT web page, where we frequently update information, research, and our activities in this page. We have been facing lots of some challenges, such as difficulty in making awareness. So especially fighting against the cultural or religious practices is very tough, and again reaching to remote areas, the rural areas, also one of the difficulties. So in upcoming years, we would like to sort of develop this technology. So we would like to replace back-end software technologies, and then we would like to improve these question sets. Not just the survey or the question set, but we would also like to take a videographic or the photographic content of those mouth cancers, and then this multimodality information can be helped to take this stage further. We would also like to do some biopsy-based techniques. So based on the surveys or the video samples, we will explain the person to or suggest them to approach clinic at the Dinanath Mangeshkar Hospital in Pune, where the biopsies will be done and the gold standards will be found out. And then after the enough data is collected, we would like to develop some artificial intelligence-based intelligent model. That models can then predict more accurate, as close as the biopsy, so that virtually we can explain whether the person is exposed to oral cancer or not. Finally, the bottom of this is something our preliminary results, where we found out that ET53 and the TRT genes are more known to be involved in many cancers, and therefore this preliminary research gave us some scope for this future work. I would like to use this platform to raise a global alarm, to explain that this is a most unexplored part of this research, and therefore anybody would like to support us in any manner would be always we will welcome. Finally, we are thankful for the Camellia Foundation for the generous support, AGENT and the University College London for providing us resources to conduct research, and General Angeshkar Hospital at Pune and the Foundation Medicine at US for providing us samples. Thank you.